Hi, everyone, and welcome to our Prenatal Wellness Talks. Today, I'm joined by Geraldine Nyaku, and we'll be talking about something which I think is very important. It's how legal systems can affect women's choice and rights during labor and birth, and how they are impacting midwifery care. Thank you, Geraldine, for joining us today. Such a pleasure to
Happy
have
to
you.
be. Thank you, Susanna. I'm happy to be here.
Okay, so to start, let's tell us a little bit about yourself, your journey, what inspired you to advocate for maternal and newborn health.
All right. So I am a lawyer by profession. I'm looking forward to being a mom. I think I've been in the development sector for almost 10 years plus now. I started in family law. I was part of an organization, a nonprofit organization for women lawyers that focused on family law. And during my time there, we did litigation plus transformative justice, where we went into communities and educating women on family laws and their rights. So I did a project that focused on violence against women in public spaces. So in that project, there were like some elements of reproductive health that started coming up. So I just had a glimpse of reproductive health for women a bit, and I didn't have much understanding of it really. I was more into the whole domestic violence, gender-based violence, and all that. Since it's so broad, you can find that reproductive health is also somewhere in there. When I left, I saw an opening for a national coordinator for White Ribbon Alliance Zimbabwe. Now it focuses mainly on maternal and newborn health care and advocacy on that. When I joined, I love new adventures. I love, learning new things, getting out of my comfort zone. So there was I went into it not knowing much about it. But what sold me about maternal health was when I came across respectful maternity care. So now, the lawyer bell just rings in. Also, we're talking about rights to dignity. So when I saw that, okay, the rights and maternal health, they kind of interlinked, that's where my journey started. That's where I'm trying to go. That's where I got myself into the sector for maternal health. It was very interesting, and it's still interesting, and I'm still learning. So that's how it all began. And I was now passionate about it because I learned that my grandmother, my mother's mother, was a midwife. So it began to make sense. I was like, oh, okay. So she made a lot of sense back then. So it all came together, my personal experiences, and then, just coming to this sector and understand. Then I fell in love with it. I fell in love with respectful maternity care, to be specific.
I think there a transgenerational call in your family. It's amazing. It's amazing that you went through all of that and then you found out, that in your family there was a pattern already there.
Exactly. Exactly. Yeah. So that's a
Amazing.
bit about, yeah.
Amazing. And how do you think that traditional cultures practices around childbirth interact with the modern healthcare approaches?
Um, Susanna, when we look at childbirth, it it was deeply rooted in cultural practices. Before the hospitals came into being, we had our grandmothers, our ancestors giving birth in homes and elderly women helping them to deliver. So we can never divorce culture, the importance of culture, from a woman having a positive childbirth. And these cultural practices, I believe, have been adopted. Some of them have been adopted into the modern healthcare systems. And some of them have been uh, shunned away. For example, the the practice of having a birth companion, all right? We say it's very important when we talk about respectful maternity care. But in my African culture, if I still remember from the stories that I heard, was men were not allowed when a woman was giving birth. They were not allowed in the room. They're not allowed in the room. And some religions still practice that. They still uphold it and say it's a very woman private experience that men don't need to be involved. But other modern day healthcare says, you know what, a birth companion is important. And sometimes it doesn't have to be the partner or the husband. It can be whatever companion it is, a sister, somebody there to give them that emotional and psychological support that they need. I believe back in that day, you obviously had probably your mother there and your aunties there. So we still carry that with us. So that's how important it is. And when we disregard these cultural practices, we are in a way infringing the rights of the woman to their choices. Choices of birth choices, birth delivery, how they need to deliver. It also affects their right to those kind of choices. So we really need a very culturally sensitive healthcare system. I'm sorry, I don't want to go on and on. I really want this to,
yeah. No,
I'm
listening, and I'm at the same time thinking, because one of the things that we advocate here at Prenatal Alliance is that birth was never meant to be done alone. The center should be definitely be the relationship between mother and baby. And it's very interesting that you're saying, you know, fathers were not there, but the center was definitely the experience of the mother and the baby. At conception, the experience is of the mother and the father. But when we are talking about pregnancy and when we are talking about delivery, childbirth, the experience is, the main focus is the mother and the father. And in our modern society, especially in the Western world, we are seeing a rise of loneliness. Mothers feel unsupported and lonely in pregnancy, and especially when the time of delivery comes. So it was never meant to be done alone. And it is true that couples have moved out from the house of their parents and grandparents, and that has given them more freedom, more autonomy. But we have also lost that sense of relationship. And there are a lot of women that feel that are fearful of childbirth because they have never experienced it in their lifetime. They were never with another woman that was giving birth, and those experiences were actually being passed on from generation to generations, because, as you said, they were with their mothers, with their aunts. Everybody was there to help and to support. So it's very interesting that you're saying that that kind of the changes in culture are also changing the way that we take care of women. You share with me a couple of studies, and the brief highlights that maternal health is unique in medicine because informed consent can be legally overridden during childbirth. So how do you see this exception affecting pregnant people's fundamental rights, and what are its real world implications?
All right. Informed consent, it has been, well, I worked on a campaign called What Women Want campaign, what Rebel Alliance did and other alliances across the globe. And one of the wants of the women was informed consent. We want informed consent. But when we look at it legally now, informed consent is not as simple as we thought it would be. A research was done by the Center for Reproductive Rights, where they really dissected this particular aspect of women's autonomy, informed consent, and choice, and the legal frameworks. What are the gaps with regards to it? They really zeroed in on competent pregnant women. So the issue of informed consent, there is, you want to strike a balance. The women's rights, then we have the professions, the experts. They know what is right for the patient. They are the experts in the medical field. But also we have the woman who must have the right to choose what kind of medical intervention that they want. And there have been arguments as to say, does the fetus have a right? The woman, some decisions are made without her consent because they're looking at the best interest of the fetus. And then, but we'll be like, the woman is the one carrying the baby. She must have the ultimate decision of what would happen to her during delivery. Then there's also the issue of mental capacity. Is she in the right state of mind to make the right decision in that particular moment of being in labor and during delivery? And a lot of arguments have been to say, what about, does pregnancy mean that someone cannot think? Someone cannot make a decision for themselves? Does it incapacitate them, their mental capacity? So it's quite complex, but it's an area that has to be delved into. So I think maybe you also had a look at it, Susanna, at that kind of research. And the debates that went back and forth on that one. So the law is very vague on what are the emergencies, what are the specific emergencies that women can have a choice in, and where they don't have a choice in, where the medical practitioner will make a choice on their behalf. That's so what's really needed at this point is to really dissect all the legal frameworks. We have international instruments that we have. For example, the CEDAW, the Convention on the Elimination of Violence and Discrimination Against Women. Then we also have the Universal Declaration of Human Rights. In Africa, we have the African Charter of Human and People's Rights on the Rights of Women. I'm sorry to go on and on about that, but they mention about the women having the right to informed consent, but they do not specifically dissect it to what happens during childbirth and delivery, because those are very tricky. That's a very tricky stage there's a lot of emotions going on psychologically. There's the pain going on. And I think the perfect example would be during COVID-19. There were high risks there where the women at the testimonials that I got from the women, they really didn't have a choice as to whether they should have a birth companion, because there were regulations that say, this is a high risk pandemic that we're in. These are the restrictions and the regulations that we're going to follow. Some of them had forced cesarean sections. They didn't consent to that, but they were told it's in your best interest. So there needs to be a clear limitation of rights of both parties, the women and the medical practitioner. So the law is a bit ambiguous and vague with regards to that.
Yes, and regarding to that, now that you are speaking about that specific period of time, there was and specifically about pregnancy and childbirth, there were countries that adopt totally different measures from one another. That was not even consensual. I remember that we at Prenatal Alliance received some women asking, what is going on? They are taking our babies from me. And this was particularly done in Portugal. And when we looked at what was going on in the UK, was exactly the opposite. The baby was never left out of the mom. So the baby was delivered and was, skin to skin with the mom and all of that. So what you're saying is that there is like a space in the regulations, in the law, or how you want to put it, that it's ambiguous and nobody knows exactly what they should do. But when we put the center of policies being the mother and the child, maybe there's something that can be, more consensual. What do you think about that?
Yes. If all healthcare could put the mother and the baby at the center of it all, that what we are all waking up and working towards is for the mother and the baby walking out alive. It's for maternal mortality to be very low. I know it's unrealistic to say zero, but hope we get there. That is our goal. So all policies should be women-centered, should be children, newborn-centered. That's how we can actually come to a consensus as to what should our laws and the gaps, how should we bridge them. But when we look at protecting our own professions, because there is the risk of litigation, we need to understand the medical practitioners' fears that, and there have been so many cases of the hospitals being sued, of doctors losing their practice licenses. So we need to strike a balance there, that as much as they are rights, they are also responsibilities. Rights come with responsibilities. Is the woman making the right decision for herself and for the baby as well? So I think that's where we have a lot of work to do. And I'm really excited that the Center for Reproductive Health, for Reproductive Rights, they came up with this research for us to really read and brainstorm and talk about the uncomfortable.
We are going to leave the links on this video. We are talking about the study about legal threats to autonomy, choice, and informed consent in labor and childbirth. And the study also identifies 5 legal factors that undermine autonomy in childbirth. Do you want to, just share with us a little bit about those emergency exceptions, although we know that it's a little bit ambiguous?
Some of the emergency exceptions would include, for example, what medical intervention is needed by the woman, for the woman, by the legal practitioner, and other factors as to informed consent, the type of delivery that they would want to have. When I came into White Ribbon Alliance, I always want to put it personal to me so that, the cause is at my heart when I relate to it. Also personally was, I didn't know that there were so many birthing positions that were available to women. So when I came across my predecessor, Dr. Christina Roden, she's the founder of White Ribbon Alliance Zimbabwe, she told me, there's so many birthing positions. There's the squatting position that's there. And I'm like, all I know is that a woman lies down on the bed, she opens up her legs, and that's how she gives birth. And it seems as if when you talk to more women, they tell you, we're never told about the different or various birthing positions. So there is that, like during delivery, what kind of birthing experience do you want to have? So those kind of factors where there isn't that informed consent. Either information is withheld, it's not even communicated, or it's withheld on purpose, or it's not even explained. And it also, we cannot really always blame the legal practitioner, the medical practitioners, because there's also shortage of staff. You have, maybe 5, 6
and a
women
lot of them are doing their very best. They really want a positive outcome for that mother and that baby. It's not, we are not talking about that, there is this people that are doing that or no, we are all trying, but there needs to be a middle where we can all speak and talk, and women need to be very vocal also, I think, about this, because the way that we were giving birth maybe 2 or 3 generations ago is totally different from what is happening now and how medicalized birth has become.
Yes, I totally agree with you on that.
And are the most urgent policy changes that needed to be addressed to better support mothers and babies worldwide?
The urgent policies that need to be done right now is to integrate midwifery practice into the health system. And when we talk about midwifery also, I'm sorry, I'm not an expert in midwifery, but I have seen that there is that we cannot talk about we cannot talk about childbirth without the midwife. We can never separate the two. It is impossible. So we need those kind of policies that makes the midwifery practice flexible. There seems to be regulations that are fragmented. If they're not fragmented, they're not as flexible as they should be. Midwives do not have the autonomy to practice midwifery as they're supposed to. For example, I can say, I didn't know what a midwife was as old as I am. Like, I didn't know the difference between a midwife and a nurse. And this is everybody on the street, if you ask them, just maybe in a shopping mall or something, and you ask them, do you know the difference between a nurse and the midwife? They're like, it's that integration, policies that focus on that, so that the population knows the importance of midwives, knows their role, knows how to exercise those privileges that midwives provide. You can exercise something that you don't know. So I think that is very pivotal at this moment. And also riding on the research that has been done, I can just mention the recently launched implementation guidelines of the midwifery model by WHO and its partners. That implementation guideline helps us to come up with so many policies to come out of there. So I think at this moment, this is what is hot and very important to focus on. Yes. Maybe I can just touch on one of the countries that I visited, and it's one of the countries that has progressive policies on maternal health care, Sweden. I had the opportunity to visit Sweden, I think 3 years ago, on a program for sexual reproductive health rights with Lund University and the Sexual Reproductive Health on Global Academy. So they took us around. We had to see how it looks like practically, because it's nice to talk about these concepts. Then it's another thing to have it practically implemented. So we went to what they call maternity homes, I think, where there is the antenatal care, and then there is the postnatal care there. And we used to ask them, do you do deliveries here? Because the environment was very friendly. The midwives seemed to be very relaxed and giving one-on-one attention to each woman who came through. And they told us that they don't do deliveries. They refer the deliveries to the health facilities. So you find that this setup has really worked well for Sweden with regards to what we're talking about, informed consent. There is enough time and to inform the woman of what to expect, what she is entitled to, what she can choose. So I just thought I should just put an example there of with the informed consent, what it looks like in an ideal setup.
Yeah. So in this matter, you are talking about that midwifery model of care, that it's being practically implemented. Is that it?
Yes, it's being practically implemented and successfully as well. Successfully implemented, having amazing results. So I can say just Sweden because I've been there, and I even went to the public hospitals. I saw the delivery room. They have the resources are there. The resources for the women and even for the protection for the midwife or the obstetrician. Everything was on point. But we're talking about first world countries. I know people were like, what about developing countries?
Yeah, exactly. I was going to ask you about that. I was actually going to ask you about that. How do you see that difference between Africa and developing countries, and from what was your experience now in Sweden?
Okay, so coming back home, what we really need down here in Africa is investment. When you everything that has, I saw that in Sweden there was a deliberate investment into maternal health care. So when we do our national budgets, we sit down. What are we prioritizing? So there's need to invest in infrastructure, invest in the midwifery education and training, and their incentives. I mean, it's world over that midwives are underpaid. Now it's time to really prioritize that profession so that they deliver the quality healthcare services that we are desiring. Mm-hmm.
And how do you see in terms of, globally and in the world, the future of maternal care? What do you think that are things that you would like to see done in our lifetime?
Okay. First, this can be very, this is my personal, and it can be a bit maybe unrealistic and too ambitious, but we need to promote, there's need to promote evidence-based practices. A lot of research has been going on, and being in research myself currently, researching for the judiciary, evidence-based practice is very important. There's been a lot of research that's been happening around maternal health, but I think it's fragmented. It's time that we bring it all together, because everyone is working on everything, but on the same thing, but we are on a different path. So it's time that we align all our research and bring it all together. That would be my desire, and to bring all the sectors together, everyone working together. We have the legal profession, we have the medical, we have the community, we have the politicians being part of it all. And I've seen this worked also in Tanzania. There has been political buy-in. That's why their maternal health care mortality has decreased a bit. There's been progress in the decrease of their maternal health care because of political buy-in. Then also, I think globally, there has to be focus on standardizing the, I don't know, please don't hold me to this, the remuneration of midwives. I'm sorry. Standardizing it, not for it to be like, oh, maybe they, no, let it be in standard, let it be in print, let it be in writing, where all the other countries that sign up to it, the same way they ratify international instruments, they ratify that standard of remuneration and incentives for the midwifery profession. There have been a lot of talks on this. I think you as you have better information on that one, but I think that would really make our interventions to produce results. Then also to invest in maternity medical homes. I've seen that happening in Zimbabwe. We have had what we call maternity homes there, but they have been in the rural areas, and they're not well supported and not well funded, but they were very significant in the reduction of maternal mortality. So I think if we can also standardize that, this is a requirement for all countries or medical health institutions to have a maternity home somewhere. So yeah, those are my wild ideas, which I think.
Yeah, I think it means that in the worldwide agenda would be to prioritize maternal health and baby health, because when we are taking care of pregnancy, when we are taking care of mothers, we are also taking care of future generations. I would like just to say that when we met each other, one of the things that you told me and that really struck me because I think exactly the same way. It's I think that we need to come out of the meeting room and really put up the policies that are really going to affect the life of a pregnant mother and of the baby. And that's why I asked you what you want to see in your lifetime. And a lot of
Okay.
things that in the beginning we thought that it would be impossible, suddenly they were just a little point in the sand in a beach that transformed the whole ecosystem. So I think we need to change the way that women are being treated. You talked a lot about, the midwifery, and they should have proper wages and so on. One of the things that we also fight for is for paid maternity leave, because in a lot of countries that it's not even addressed, and the mother needs to feel safe that when that baby is born, she can take care of that baby. And this is something that we are eager to talk about and to tell, because this is always also going to um, relieve the mother and not put so much pressure and stress. And a lot of women also feel discriminated when they are pregnant, and suddenly they need to decide between their work and their pregnancy, properly proper taking care of themselves and their baby, or working extra hours. And I wished, for instance, that in my lifetime we would see a real change also on the way that we treat mothers, and by addressing that, the future generations. Geraldine, would you like to leave just a last thought for our interview, for our
Okay.
guest?
I'm sorry, if can I take you back a bit? There's something that you
Yes, of
mentioned that.
course, do so.
All right. You spoke about maternity leave. So I was thinking of in Europe, I'm not so sure which country, is it the Netherlands? I'm not sure, I don't want to lie, where there is parental leave, where the man
Yes, I live in
and the
Norway, and
woman.
there is parental leave. Yeah,
It's
definitely.
Norway, exactly. Thank you for that correction. Yes, in Norway. And I was just thinking that when you're telling me what kind of world do you want to see, is also men being involved in the maternal health care. Like you said, when inception occurs, there's the mother and the father, and the baby comes into being. So I would like to see men actively involved, because you find that we were talking about culture during the beginning of our discussion. You find that we have patriarchal societies that where women really feel, when they have their husband's support or the support of men, they feel more empowered. We are moving towards women empowerment, to know that they have the power to exercise their rights on their own without asking for permission from anybody. But also the support of the men in society, it really helps things also to move a bit quicker, even when we are in doing debates, whether it's in our community forums, or it's in the big conference rooms, like you said, or it's in parliament, and we have the support of the men. So I really want to see that world where
and I think that
men are standing side by
changing.
side.
I think that it's changing in our days, because when we do the Prenatal Wellness Global Summit, which is an event that we do and that happens annually, half of our registrations are actually men. So I
Wow.
think that is changing. So we don't only have mothers, we don't only have professionals, but we also have men that are eager to know how to better support women. And I talked with, in one of the interviews, I talked with a dear nurse from South Africa, and she was saying no one should be left behind. And I thought that was so thoughtful about men, and not only about men, but about the family, the grandparents. Because, for instance, in Africa, she was saying that, a lot of times after, the baby is born, the ones who are actually going to take care of the child is going to be the grandparents. So they also should be, when we are planning for a family, they also should be there to understand also their role. When we say that it takes a village to raise a child,
Yes.
how they can support and how they feel that they are being part of the creation of that baby.
Yeah.
Geraldine, thank you so much for this wonderful talk. It was such amazing. I think there was many things that we can even talk more about, but I will leave you to join us in our next summit, and then we'll have a presentation from you.
Oh, thank you so much for inviting me. It was quite an interesting discussion, and I loved it. I enjoyed every minute of it. And I wanted one more thing. To support you on the World Pregnancy Day, the initiative of Prenatal Alliance. That's an amazing idea.
Thank you so much. Thank you so much for your support. Wonderful. Nice to have you.
Bye-bye.